this year we've been able to implement primary healthcare advocacy on how we are able to measure performance of primary healthcare indicators. These are vital indicators that inform the performance of universal health coverage in a county. And we are using the vital sign profile tool from the World Health Organization, WHO, which Bungoma County has been able to customize its tool from the national one, and it has a handbook for the same.
We as Bungoma, during our launch, we launched the vital sign tool, which has been used to measure indicators in our PCN. And this tool, Bungoma customized its own, and they came up with a book which was published, and we're able to find it in the website. And even if you go to the Google website, you'll still find the book. When you just Google the VSP Bungoma Vital Sign book, you'll get it in the Google's website. So from there, you'll be able to know that Bungoma, they customize their tool and they're using it in the PCNs.
This year, we've been able to push and advocate for institutionalization through various ways. We've been able to work with the Department of Health to come up with the Primary Healthcare Technical Working Group, which is mandated with the task to ensure that reviews and updates of performance of these indicators is timely and regularly, and also aspects of measuring other components of primary healthcare, such as establishment of primary care networks within our sub-counties.
This has come as a result of support that we get from the RAMCA network, which have really supported us in, first of all, coming up with the technical working group, which is a key important element in terms of how we're able to sit down and discuss and be able to monitor the indicators.
Na nafuraha kwamba leo launch ile technical working group ya primary healthcare, na ili iweze kuangalia masuala ambayo yanafaa kuzingatiwa ili tuweze kuhakikisha kwamba wagonjwa wote wanapata huduma za afya kule mashinani, na tumezingatia viwango vya ambavyo vimewekwa na mashirika ya kitaifa kama WHO.
I appreciate on behalf of the county, I appreciate the RAMCA network for supporting us to coming up with those tools, and also they also support us in data review over most of the indicators, so that we are able to make decision out of the data that we have collected using the vital sign profile tool.
Through that tool, the sub-county, they're able to identify gaps from that tool. They're able to make decision from that tool. And also it's a resource mobilizer. We're able to know how much has been allocated under primary healthcare. We're able to know how much has been allocated under the health department. And we're able to know how can we look for more money to support our health system. And
we've been also worked with health records information officers who are very paramount in data management and also monitoring and performance review. Through the team, we've been able to conduct regular quarterly review meetings with these HRIOs, the health records information officers, in all the sub-counties using the VSP dashboard, which informs some of the gaps that are identified are presented to the TWG and other high-end stakeholders at the Department of Health at the county level, who are able now to take up action and follow up with the implementation of various commitments that are being made.
Us as Bungoma County, through the partnership of RAMCA network, we try to scale up the VSP tool to all the 10 sub-counties, and they're able to use it and have taken it positively, and we're able to measure our primary health care.
And we've also gotten an opportunity to cascade or disseminate this best practice in regional forum. The county recently held a primary healthcare learning and sharing forum with the Lake region and Western region counties, which are 14 counties, and Bungoma County was able to showcase use of the VSP tool at the county level and also at the sub-county level, which has been able to inform performance and tracking of various indicators. What we are proud of as a network is the commitment by the Council of Governors to advise the 14 counties to adopt the use of the VSP tool to measure primary healthcare performance, because according to the assessment, the tool is working. They were able to assess the tool in Kimilili sub-county.
The tool has really assisted us to know the number of those mothers who are pregnant who come to the facility to be given the ANC services. And you can see we are at 91%, 92%.
Through analysis of the data, we've noted that indicators like ANC access and utilization are still facing challenges.
And the indicators were well explained according to the dashboard, and even the threshold were well defined.
The tool has really assisted us to know the number of those mothers who are pregnant who come to the facility to be given the ANC services. And you can see we are at 91%, 92%, 93%, apart from the fourth quarter that we did not do well, and we know all of us why we did not do well, because of the strike. We had the health workers strike. That's why the performance, if you look at most of the indicators, are low in that quarter.
Also, through this project, we've been able to support 3 sub-counties to conduct a maternal and perinatal death surveillance response. These are MPDSR, which are guidelines from the national government, from Ministry of Health. Counties and sub-counties and also facilities are given guidelines on how to conduct maternal and perinatal deaths on a regular basis.
And also through participating in MPDSR processes, we've noted that skilled birth attendants and deliveries are reducing over time, so that calls for targeted interventions to ensure mothers can access skilled birth attendants and focused antenatal care during pregnancy.
The MPDSR Action Tracker, this is a tool that all the actions, action points and recommendations are taken down into account and assigned to relevant officers in the Ministry of Health, in the Department of Health for the sub-county, and they are followed up upon. Another success as a network, we've been able to bring different stakeholders in different forums. At the very end of the year, we were able to bring together members of the county assembly, particularly the health and the budget committees, to engage with representatives from the health department and also health insurance experts, for us to have a discussion towards the key agenda for universal health coverage, which says that it is on the government. This forum was able to outline to the stakeholders the relevance of government investment towards primary health care, and that is the key driving factor towards achieving universal health coverage. Therefore, that platform was able to bring a consultative discussion between through a round table between the county assembly representatives, members of the health committee, and also the county executive health committee, and other stakeholders, including youth advocates, who are able to discuss and come up with recommendations and commitments towards improving primary health care for Bungoma County.
We did not have experience in advocacy, and we never knew how we could maybe go to ask for our rights elsewhere. But as Ramka Networks has taught us, they helped us know how we can develop a memo and how we can present the same to decision makers, something which we did. And in return, the government has worked upon it, and we have now started receiving stipend in a good way. I personally, I think so many changes have been experienced in my life since I started working with Ramka Networks. I've been receiving enough experience. I've been teaching the community. I've been facilitated to move around. I've been letting people know their rights. I've been asking them to see how they can present and where to present their grievances. And in most cases, we are going in for success. The meetings we are going in, sometimes facilitators, they also let us know areas of weaknesses. And when we come to the communities, you see, we feel like we can teach now these people of our community also to come up in the same way.
Tumekuwa na uhusiano mzuri na community health promoters. Wamekuwa msaada kwetu, haswa kama mimi. maana nilipokuwa mjamzito alikuwa akinitembelea, akinihimiza kuweza kutembelea kituo cha matibabu ama kliniki.
When all the stakeholders are able to come together, come up with an community inclusive interventions towards primary health care. As much as the advocacy works, there is limited investment in terms of budgetary allocation for the implementation of the VSP tool. Therefore, sustained and continuous funding will ensure that we continue advocacy works to ensure that the government fully invests in the implementation of the vital sign profile tool and also other interventions of strengthening primary health care for Bungoma County.
This calls for targeted interventions and support to ensure improved maternal health outcomes. One of the recommendations during the LREB PHC Learning Forum, it was that we include indicators such as teenage pregnancy, nutrition to be comprehensive in terms of analyzing PHC indicators. So I'm looking forward to making a follow-up to ensure those indicators are included so that the PHC tracking can be comprehensive.
We call upon other partners to support interventions that are geared towards improving and strengthening primary health care for counties and even the governments. And we also call upon the government to identify initiatives and interventions that are sustainable and are fully funded by the government.
Wito wangu kwa serikali pamoja na washikadau ambao wamekuwa msaada kwa hawa community health promoters, waendelee kuwafadhili ili waendelee kutusaidia sisi walio chini, maana hao wameweza kutuunganisha na hospitali zile za juu, maana ukikuwa mgonjwa hao ndio wa kwanza kujua. Sasa naomba kama mama wawe wakisaidiwa vilivyo, ndiposa waendelee kuwa wa msaada kwetu sisi.